Okay, so it's 6 o'clock, so we'll go ahead and get started. We have a couple people zooming or joining us via Zoom as well. So welcome and welcome everyone who's here in person. My name is Nick Scala and I am the Recreation Facility Manager for the Oro Valley Community and Recreation Center. Just to provide a little bit of background about this particular program and this event. So about 6 months, maybe even 9 months ago, we started having a conversation with Oro Valley Police Department, Oro Valley Parks and Recreation, Golden Ranch, Arizona Complete Health. There were a couple different organizations that were involved, and we started talking about the different programs we could do regarding mental health, specifically for the community of Oro Valley. And so we led to some really good conversations. Back in August, we did a community conversation on mental health that was fairly broad. And after that, and getting it was a very good engagement from everyone that attended, a really good discussion from our panelists as well. So with that feedback, we heard from our residents that they'd like to see more of this. Our commitment is to do this 4 times a year. So this is our second one. And also have more of a focus. So the focus of today's discussion is to talk about some of the added stressors that come with the holiday season. So I will now introduce, or I'll allow our panelists to introduce themselves. And after that, we have some questions, and then we'll of course open it up to anyone who has any discussion topics or any questions that they'd like to share with us. So I'll go ahead and start with Chris here. Thanks.
Thanks, Nick. Hi, good evening. My name is Chris Grissom. I'm a deputy chief with the Golden Ranch Fire District that serves the communities of Oro Valley, Catalina, and Saddlebrook. I oversee our EMS and our training, but something I'm very passionate about is I also oversee our health and safety division, which also has a member, 24 firefighters that are on our peer support team, trained in CISM, and really looking forward to this conversation, and I appreciate your time. Thank you.
I'm Jason Horetsky. I'm a sergeant with the Oro Valley Police Department, and I oversee the mental health support team.
My name is Dr. Courtney Shinneman, and I'm a clinical psychologist in Tucson, Arizona, Southern Oro Valley. I'm also the president of the Southern Arizona Psychological Association. We are a group of psychologists in Tucson and Southern Arizona, and we do a lot of outreach to the community, a lot of topics on mental health, and providing resources to the community. So we are glad to be here today.
Hello, I'm Shannon Sticken. I am a clinical psychologist as well, and I am part of the Southern Arizona Psychological Association. I am the SAPA and the community chair, and our committee does a lot of outreach to different organizations in the community to bring awareness to mental health, and I appreciate being here. Thank you.
Hello, good evening. I'm Maria Stengel with Arizona Complete Health. I am a first responder liaison on our justice and crisis team. Arizona Complete Health, if you're not familiar, is the regional behavioral health authority for Southern Arizona. And we oversee all of the crisis services. So crisis line, crisis mobile teams, some of the material that you see on the screen and also here in the room are related to those services. And I'm very happy to be here tonight. Thank you.
Good evening. I am Christy Diaz-Trahan, the Town of Oro Valley Parks and Recreation Director. Our programming is important to the physical, mental, and spiritual health of individuals as well as our community, and I'm happy to be here. Thank you.
And I'm Shelley Jernigan. I'm the Communications and Event Director at NAMI Southern Arizona. I am also the Family Support Coordinator and an advocate as well. And we provide no-cost advocacy, education, and support to all of Southern Arizona. And I'm very happy to be here today.
All right, thank you very much. So we'll go ahead and get started. I've got some general questions that we'll ask of the panel, and we can have a good discussion. So my first question is, what can I do if I'm feeling lonely or isolated during the holidays.
I'll get started. This is Christy with Oro Valley Parks and Recreation. So I read the Sunday Arizona Daily Star and found an article in there a couple weeks ago that I copy and pasted because it was pertinent to today's discussion. So bear with me while I read and talk this through. So the psychologist that wrote the article said, if you're feeling low and not really wanting to engage in the world or even with your dog, something is holding you back. It's important to know at this point, it doesn't really matter what's holding you back. It's just something is. And even though part of you is fighting against feeling good, you have to fight back to that and allow yourself to have fun and feel love and take a moment to feel good in life. He said, try just 1 minute. Walk outside and look at the sky for just 1 minute. That's all you have to do, is just do it for 1 minute. And then try petting your pet if you have one of those, just for 1 minute. And let that sense of feeling and warmth and joy take over your body. That is where you need to do. The intent of the article was you have to start and just start with 1 minute.
Shelley Jernigan with NAMI. Going off of what Christy just said, yes, the biggest thing is don't isolate yourself. Call somebody. You're not alone out there, and somebody is there to lend an ear to. A lot of times it just takes talking to somebody, even if it's just over the phone, but do not isolate yourself. If you cannot get in touch with somebody, you can always call somebody at the new 988 suicide line. If it gets that intense, don't let it get that far. Or you can call the hotline at 622-2000, and that's our warm line, and they're there to just listen. And a lot of times that's what people need during the holidays, especially just having somebody to listen.
Shannon Sticken from Southern Arizona Psychological Association. I think that also for people that are struggling with substance use and abuse, the AA and NA have meetings every day, even on Christmas and Christmas Eve.
Courtney
also-
Shinneman.
Oh, sorry, go ahead.
Oh, sorry. Courtney Shinneman, Southern Arizona Psychological Association and private practice. I like to have a lot of tangible ideas when, because there are a lot of people that feel lonely during this time. And so going and being around others, like going to an art festival and just walking around and seeing people and people watching, going to a mall and just being around others can be very uplifting, good for your brain chemistry, and can get you socializing a little bit. So a lot of times, as you said, don't stay home, go to a coffee shop, get a nice book and just be around other people. If you can't be with family, or you're missing someone truly, or you've lost someone this year, find some way to maybe honor them or do some memorial for them, to bring all of those together that are missing that same person. Start a new tradition, maybe a new hobby, something that brings you joy. You're going to hear me talk tonight a little bit about self-care. I am all about self-care. And so how do you start with exercising, eating well, getting out of the house, get up, get out, get going. So whatever that takes to kind of get around other people, to kind of push through that loneliness, to push through those feelings. At the same time, I also recommend to make time for those emotions. I'm a little biased as a psychologist. How do you feel those feelings and not avoid and not use overeating or drinking or all the other unhealthy behaviors we use to just avoid and distract yourself? So being aware of the unhealthy habits. And one thing I really love about the season is there's so many ways to be altruistic. How do you get out and help other people? There are, gift wrapping and donation groups and church groups and so many places that are looking for help, food drives that you could do to be able to connect with other people that have that same altruistic aspect, and helps you connect with others and not feel so alone.
All right, thank you. Yeah, go ahead.
Courtney Shinneman, Southern Arizona Psychological Association. Another thing I was going to say is like, there's some great online groups that can really help. And I have a, like on one side, stay off social media because you're just going to compare yourself to everybody else that has the picture perfect holiday, which, you know, it's just like the 5% of their life that they're actually posting. So remember to keep that in, you know, realistic perspective. But also there are some great online groups that you can connect with. And I see, you know, on Oro Valley Community of Women, there's like 5 happy hours going on this next week of just in bulk community, anybody who wants to join. So using resources and using some social outlets can be helpful, but just moderate it.
Yeah, and there's also some really great volunteer resources, and we'll make sure there's a good, within Pima County, there's a good website that kind of you share your interests and then they kind of help generate some potential volunteer opportunities. So we'll make sure that that's available on our event page as well. But I think that that's a good point. That's a good, especially this time of year, to be able to give back and volunteer. Well, we do have if anyone in the crowd would like to ask any questions, we also have some people that are joining us via Zoom. So if anyone has any questions or comments or discussion topics they'd like to raise their hand, we can unmute them. Or if anyone here would like to, has any comments. Yes. Oh.
Hi, I'm sort of interested in any kind of reading material that you might recommend that would help a person sort of gird themselves when they know each year this is going to be a tough time for them, so they can kind of get ready for it. So
NAMI Southern Arizona actually just came out with a book this year called You Are Not Alone. You can find it at Amazon, on Amazon Prime for $17.89, and you can purchase it at Target now for $17.99. It is, you know, I actually have it in my car. I could actually have my husband go and bring it out. Back seat, bottom floor bed. But yes, it is called You Are Not Alone. They are already writing book 2 for next year to come out in the fall, based on just youth and adolescents with the mental health on how to deal with things. But this book goes from A to Z on how to deal and cope with mental illnesses, mental health losses within your family, you know, how to deal with a family member, and, you know, some resources, where to go. It is an absolutely amazing book. And it just came out September 1st.
And if I may, I just did a quick Google search. Our local public library has that book on the shelf. So you can go to the Green Valley Library, the Oro Valley Library in Ajo, the one off of Valencia in Marana. So if that is a great option for you as well.
Do you, Courtney Shinneman, Southern Arizona Psychological Association, are you okay reading resources online? I do understand, but that could be an option. As there was some really wonderful articles, and I can write it all down for you at the end, but it's the American Psychological Association. And if you literally just put it in Google, American Psychological Association holiday stress, and they had like 18 different articles on coping with holiday stress, financial issues, all of that, dealing with loss of a loved one during the holidays. There's a plethora of information on there.
And actually that link has also been posted on this event page too.
And so I've also brought a flyer that we do at NAMI every year, and it is literally coping with the holidays. And at front and back, it gives you tips for persons living with mental illness, tips for your family and friends, and tips for communities of faith as well. Well, at NAMI, you can go online at namisa.org. And you can look it up and we have it there on the flyer there. Other than that, though, it's just kind of like what you said, you run into it. But I'm going to make sure that the flyers that I brought tonight stay here.
Okay. All right, so I've got another question for the panel. What are some tips for managing the added stressors from the holiday season?
This is Chris Grissom with the Golden Ranch Fire District. This is a great question, and this is something that we talk about a lot at our fire district. You know, releasing the dopamine and the endorphins, getting that going. I think that's the best way to start. You know, getting outside, getting that vitamin D, exercising, sleeping right, eating a protein-rich diet. Being around here in Oro Valley, there's some of the most amazing parks and hiking trails that I've seen in a long time, and that's the truth. You know, I'm at Riverfront Park often with my kids, and the vibe there is so good, and the walking trail there is such a positive vibe, and it's such a great place to be. So Christy, great job with all the parks, by the way. But anyway, just getting outside, that's something that for me, that works for me personally. I don't know if it'll work for everybody, but I know it works for me and a lot of the men and women that we work with in the fire service. And so those are just some tips that I would say. So.
And this is Maria Stengel with Arizona Complete Health. Just on a personal level, what I have found is saying no sometimes to certain things, and that's more related to work. So recognizing that maybe sometimes I tend to work too much or work too hard or work longer hours. And so if someone says, hey, can you take on this project? Thank you so much for thinking of me, but I'm going to pass this time. So just to help reduce some of that stress as well. So it's okay to say no sometimes.
Shannon Stickens, Southern Arizona Psychological Association. I also think for me personally, figuring out what I'm going to spend ahead of time and limiting my budget. I have already told my family, you're getting limited amount of gifts this year because of inflation. So I think that figuring out your budget ahead of time and determining what you're going to spend or not spend.
Courtney Shineman, Southern Arizona Psychological Association. When we were told about this question, I thought about what are the top 3 issues we tend to see. And a lot of times with the holidays, it's money, time, and family conflict. Those are the top 3 things I hear about during the holidays. And so I see a lot of smiles and giggles out there. And so I can go into a whole little spiel about spending if we want to go to it a little bit on ways to kind of plan with the finances. But along with self-care, and I'm totally with Chris on that, like get up, get out, get going. Exercise is so important. I do have a great self-care assessment out there to really make sure you're continuing to do good self-care during the holidays, because a lot of times between the hustle and bustle and the decorating and the making everybody happy and buying everybody presents, we forget to take care of ourselves. So first and foremost, I always say, like, in case of an emergency, put your oxygen mask on first. So self-care, self-care, self-care. If you need to some night, take that bath, relax, make your surroundings enjoyable. I love say no. Then also, again, as I said, letting go of expectations with having the perfect holiday. And then I have kids. And so we have, recitals and these events and school events. And it is chaos. So I said in the beginning of the holidays, we want to go to Winter Haven. We want to go do this event and these 2 other events. And then of course we have to do the 2 work holiday parties. So those 6 events went on the calendar and then said, you know what, but this is going to be a fun family night where it's just relaxation and self-care time. And so how do you plan that into your calendar ahead of time to make that self-care time a priority, to make that calm family time a priority? And then I think also with the family conflict is having that communication ahead of time. What are we expecting? I tell my kids the season's about giving, it's not about getting. So our limit is this amount this year and take it for what it is, you know? And so how do you have those clear expectations in the beginning of the season or even like September, you know, of what Christmas is going to look like this year? Is it going to be about experiences or is it going to be about gifts? Give me, give me, give me, you know, how do you have that conversation ahead of time and make sure you're on the same page?
Yeah, and that actually kind of leads into another question that we had that we can explore a little bit here, which is what kind of resources or, you know, what's available when it comes to if someone is struggling with finances during the holiday season.
Shelley Jernigan from NAMI Southern Arizona, and it was pointed out to me, which I didn't even think about. NAMI stands for National Alliance on Mental Illness, just in case somebody didn't know. I have brought, there are 14, and it's resources for struggling families during the holidays of different places here in Tucson, and I think a couple in Sahuarita, and they all that are on there provide food boxes and gifts for your children if in need. And like I said, there's 14 on there. Actually, a little more if you add in some of the interfaith community services and stuff. So it's right up front here.
Christy Diaz-Trahan, Oro Valley Parks and Recreation. I think also, rather than a gift that's wrapped, is giving the opportunity for an experience. And there are a lot of experiences in Oro Valley and throughout Tucson that are either free or very nominal. And that then can build the beginning of a tradition for your family. And for example, if the decision is on Christmas Eve, right before sundown, we are going to take a walk around the block, or we're going to go to a park or a nature preserve. And the entire family and anyone else that wants to join us can join us. And you take your hot cocoa with you and you put your silly hats on, you develop a playlist that you're going to sing. You're not going to listen to, you're not going to pop the earbuds in. You're leaving your iPhones either in home or in your pocket, and you just walk and you talk and you enjoy and you laugh and you giggle, and people are there to sing the song wrong because that's what's going to be remembered the following year. And then that family member is going to be teased about, oh, remember when you sang this wrong? And that becomes the story. That becomes the story, and those things that you can fall back on and remember as a child. And then as you become an adult, you can tell those stories. And those are experiences. There are plenty of them. So I would strongly recommend just thinking about that. What's the experience you want to give, and what's the experience you want to get? Give yourself that gift.
All right. Well, thank you. So any other questions from anyone that's here in person, or we still have a few people joining via Zoom. So if any of you have any questions, feel free to raise your hand. Oh yeah, hold on.
So it's a time of year when you have lots of things hitting you at the same time. How do you triage from among the opportunities that you have at the same time. For example, tonight we have this. The Chamber of Commerce is also having a volunteer appreciation meeting. I came here because I thought I would learn more from this than drinking and eating donuts.
I'll get started, and I'm sure that we all have answers. So this is Christy with Oro Valley Parks and Recreation. I think that's a value proposition. And when you take a deep dive in your heart and what is going to make you feel best. And that would be my, for me personally, that's how I would gauge that. And sometimes it may be something that doesn't make me feel best, but the fact that I may be making someone else feel better for showing up and participating, that actually does make me feel really darn good. So thinking through not what you're going to lose, but rather what you're going to gain. That would be my recommendation. Yes. So yeah, I'm also a club softball coach. And so we have practice. I had a coach, 2 coaches out of 4 of us, 2 others, just their children are sick. And so now I have my other coach hanging tonight with 14 little girls. So yeah, there's a bit of guilt in there. But when you do have a choice, right? When you do have a choice, and it's maybe not the triage, you know that there are multiple things going on in one evening. I think people also can be gracious in knowing that you can't attend because there are so many things happening specifically this time of year. And just let them know that people so understanding in those issues, specifically this time of year, because there is a lot happening.
Those are great answers. For me, I'm just going to be honest. This is where I struggle. I've got 3 boys. I coach football. I'm not good at that. I just do what my wife tells me, to be honest with you. He knows back there. But anyway, and then what Maria was saying earlier is just learn how to say no to some things. It's really hard at this time. There's so much going on and you want to do everything. And then for me personally, I feel bad if I can't get to everything. Just got to let it go. It's kind of what I've learned is just let it go. And your time is valuable with the people that you love and that care about and your friends and family. So, you know, it's for me, I struggle with that. So I hope that helps somebody.
Well, I'll speak for everyone when I say that I really appreciate all of you making the choice to come here today. So, and everyone in the crowd as well. So thank you very much. Any other questions from anyone? I know we just had someone arrive, but any other questions, comments? Here, let me grab the mic for you.
This is more of a comment than a question. My name is Felix Bacadoro. I just moved into the area. I wanted to point out a critical aspect of when you do have loved ones who are struggling with whether it's substance issues, mental health issues, it's very important to not say, just don't worry about it. Okay. Because I think people, even people who are struggling, they really want to enjoy the holidays, but they're struggling. And sometimes to say, hey, just forget about it, can we have a good time, is absolutely dismissive. You know, what really needs to happen as mental health professionals here is that connection with people. So to be there with them and be present, I think is very important. And for anyone to just think it's easy to turn off any kind of mental health issue and be happy, I think we all know that that's ridiculous. So I just think it's very important to bear with some of these people as well, because they're trying to have a good time, and don't dismiss them, because I think it's very important. So thank you.
Courtney Shineman, Southern Arizona Psychological Association. I'm gonna just say SAPA from now on. I worked with the Air Force for quite a while and work a lot with first responders, and it is a lot of suck it up and press on, son, and a lot of the invalidating and dismissing it and sweeping it on the rug, or using, things to distract, electronics, food, alcohol, drugs, whatever we can use to avoid, distract. And I think sometimes it is like, hey, I know this is just, I shouldn't swear, a crappy time of year for you. I know you're probably going through a lot. How about let's just, get some good grub and bring it home and we'll watch some kind of movie together and just have a chill night. Just so, as you said, that connection is so important, where it's just spending time, letting them know that you're there for them. Maybe even just, on your way home, dropping off like a sweet little something at the door that you picked up for a couple bucks at the store. I thought about you, saw this at Trader Joe's. Here you go. Just want to let you know I'm thinking of you. Just reaching out to people at this time of year. It just means so much, because it can be so lonely and so hard for people with mental health issues.
Well, and that's kind of a good segue into another question that we have here, which is, when should I reach out for help? Because I think that's kind of, for a lot of people, that's the knowing that threshold, or knowing when it's time to reach out. And then kind of a secondary question is how do I reach out?
Shannon Sticken, Southern Arizona Psychological Association, or SAPA. I think you reach out as soon as possible. I know this time of year, a lot of clinicians are booked. Ask if they, have a wait list. Ask if they have any referrals, anybody that they would recommend. You can go to the Southern Arizona Psychological Association website, and we have a list of psychologists on there. You can also go to Psychology Today, and you can type in specifically what you are looking for, male, female clinician, what type of things you want to work on, what type of therapy you want to do, and it'll come up and populate a list. Also, with those that have insurance, if you call your insurance, they should be able to provide you with a preferred provider list.
Christy Diaz-Trahan, Oro Valley Parks and Recreation. My recommendation is reach out before you think you need to. Oftentimes, we try to mask and be strong and suck it up, because we have to have that front for our spouse, our children, our parents, our coworkers, our boss, our dog, everything in between. And before you know it, it's built up so much. You are likely on the verge of a crisis. So reach out, and reaching out is just making a connection. At some point, you may need to reach out to a professional for that professional advice, but many times reaching out before you even think that you need to, when you just start having those moments of melancholy or anxiety, when they start bubbling up in your body, because your body talks before your brain recognizes it, right? Your body is there. Begin to reach out immediately to someone that you trust, and that will accept your struggle at that moment, and not tell you, oh, suck it up, or, oh, it'll be better tomorrow. That's really key. And then on the flip side, if you happen to be the recipient of that, be gracious and be respectful and be compassionate, because it's an honor to be the recipient of that. That means someone that's hurting is trusting you with that. Thank you.
Shelley, NAMI, Southern Arizona. Just to add to what Christy and Courtney said, don't allow the stigma of mental health hold you back. That's the biggest thing. Stigma is the biggest word out there right now, and you cannot allow the stigma of mental health to hold you back.
This is Maria Stengel with Arizona Complete Health. Just wanted to remind everybody as well, so some great tips as far as accessing services through your doctor or checking online. You always have the crisis line. You also have 988. All of those services are free. They're available every single day. If you are calling for yourself or you're calling for someone's behalf, those services are available for you, always available. So there is information on the website. There's also information for those of you in the room if you have questions. Thank you.
Courtney Shuneman, SAPA. I was just going to say a lot of times my clients realize, you know, I'm always about prevention. You don't bring a car to the mechanic once it's broken down. You got to actually do the oil changes. You've got to, you know, fix the spark plugs. You got to do maintenance on that car. And so just like all the things that you care about, your house, your things, you also have to take care of yourself and do preventative maintenance. So I always recommend to kind of have a connection with a therapist before you even think you would ever need it. And also be aware of little things. Like a lot of my clients will realize, oh, I'm not returning text messages. Oh, my inbox has gotten really full. I'm just feeling a little irritable at like somebody was just so cheerful at the store today. And I don't know why I got so irritable at that. Irritability is a sign of melancholy and depression. And a lot of people don't realize that. The household chores, keep that pile of laundry, like my house is higher than that ceiling over there. And hygiene, my gosh, it's been a few days. Maybe I should probably take a shower. So being aware of how, you know, your moods affect your behaviors and being able to see the red flags before it gets too late is what I always recommend.
And if I may, I think it's important. So many of the characteristics that Courtney just mentioned, if you are a friend, a family member, a loved one of someone, and you see those tendencies, you see those behaviors of change in someone you loved, you start the conversation, you take the initiative. And even if you get blown off, if they're like, oh no, I'm fine, I'm good, be persistent, because you know that loved one, you know that person really well, and you know that it should not be blown off.
Okay, do we have any more comments from anyone in the, yeah.
So one of the issues was reaching out, and certainly in my own practice, a lot of my patients have reached out to the police or to the fire, whoever's manning that 911 line. How are those folks instructed? What advice are they giving, and are they comfortable with it?
Jason Oretsky, the Oro Valley Police Department. When it comes to calling 911, and you will get an officer there. We respond to everything. If you need help, we will provide you the resources to get any type of mental health. If you're in crisis, we can bring the crisis mobile team out. They will talk to you. If you need a ride down to the crisis response center, we will gladly facilitate that for you. We'll give you a ride. We're there to provide you resources in the crisis that you're in at that point. The preventative measures are seeing the signs in yourself and acknowledging that you're about to be in crisis and how to prevent that crisis. So we're there for that in the moment now. Crisis that you're feeling, we can help you. And the panel's here for how to prevent it from getting to that far. No, they're not going to refer you to a psychologist or a therapist. That is not what they do. We're not going to refer you to anybody as well. We bring you to the people that know who exactly you need to go to, for what reasons you need to go to see those individuals for. For law enforcement or? So when it comes to mental health issues and crisis issues in law enforcement, or when we respond to those types of calls, we try to bring the resources to the residents, so we don't have to displace anybody. Most people feel the most comfortable in their own residence.
This is Maria. I just want to add quickly to that. So for Oro Valley Police Department, if someone calls 911, just to Sergeant Horetsky's example, and they're experiencing a mental health crisis, a lot of times what happens is officers go out and check and see what is actually happening, and then they may request a crisis mobile team come. So crisis mobile teams are behavioral health technicians. They're available 24/7. They come out wherever that person needs assistance in the community. And just like Sergeant Horetsky mentioned as well, we find that people do better if we don't have to take them somewhere. That's a very scary thing. Some folks definitely need that level of care, but most of the time folks do not. We can stabilize them in the community and still connect them with services and resources. So know that all of your law enforcement officers in this area are very familiar with, I need crisis here. I know what's going on with this person. And so they're very, very good about getting the appropriate services out as soon as possible.
And this is Chris with Golder Ranch. And to tie on that, when we respond, it's more for if there's a medical emergency, any type of transport we would do would be to an ED or a hospital. It wouldn't be to a facility, but like the panel said, that we always try to keep the individual there, have the resources come to you. We do have a CAP team, a CAP team that we use, and it's 3 individuals that are incredible young ladies that will respond to assist the community as well, similar to like a Red Cross that will help, and they will provide resources and anything that you need. But for us, I know our dispatchers are trained heavily in calling the appropriate resource. So that's really kind of our end on that. It's more of an emergency type situation, but so. Community assistance program. Yeah.
Okay, do we have any other comments or questions? Again, if anyone that's joining via Zoom would like to share anything, you can raise your hand and we can unmute you. Well, in the meantime, I know that a lot of our panelists have shared a lot of great resources and programs, but I'd like to give you all an opportunity if you have any additional, anything additional you'd like to share with everyone, whether it be a program or a resource or something that you find especially helpful, especially, kind of talking about our theme and, dealing with the added stressors of the holiday season.
This is Maria with Arizona Complete Health. So just an additional resource for those of you that are parents of teenagers. I just want to point out there is the Teen Lifeline, which is, again, for your teens. They can either text and talk to a peer, or they can use a phone and make a phone call to a peer. My guess would be they're probably going to text more than call, but that is an option for your teens. And I can tell you in the work that we do with crisis services, we do see our teens reaching out for services more, especially during breaks from school. That can be a time where maybe that peer support structure they have at school is not available, and now they're kind of struggling and not sure who to talk to. So that is a great resource as well. And I also just want to add that the crisis line does also have a text option now. So as an adult or as an adolescent, if you want to use the crisis line, you now have the option to text as well. And the text is for HOPE, for HOPE is the text that you would use for the statewide crisis line.
Christy with Parks and Recreation. So from a Park and Recreation perspective, our role is I would argue that it's in the preventative arena as well as in a recovery arena. There is and has been and continues to be a lot of research related to the value of physical and mental well-being in terms of being outside and being in nature. Oro Valley is prime real estate for that. Just walking outside, bathing in nature is a term whereby you immerse yourself in the woods, in the forest. We have Catalina State Park, for example, our Vistosa Trails Nature Preserve. I was out there I put myself in timeout over Thanksgiving because I needed a break. And as a coach, the word timeout means you're stopping the momentum of madness, right? So you're stopping errors, you're stopping something from taking you out of a success story. And the whole point of the timeout is pushing pause, stopping the chaos, repositioning your mind and body so then you can re-engage. That's what it is in athletics. As a parent, we send our kids to timeout, usually because they're in a tantrum. They're screaming and crying and because they've lost control in that moment. And the whole point of timeout is to stop and breathe and take pause and get back into a better breathing and mental habit. So I put myself in timeout over Thanksgiving because it was a lot. And I went for a walk at our Vistosa Trails Nature Preserve, and it was beautiful. And at one moment, there were 5 deer just munching on some neighbor's tree, lucky them. And, they turn around and look, and then they just sort of trot and start bouncing across. And there were another half a dozen or so folks walking in and near me who just stopped in awe. And that's, a 3 o'clock in the afternoon on a Sunday in Oro Valley. That could be part of your preventative in terms of getting your mind and yourself and your body some air and oxygen into your body to help your soul, but also in terms of a preventative thing. So if you have been in a stressful moment, take the time again to be outside, and even better, take someone with you, because that human connection has tremendous, as much tremendous value as does being outside. Thank you.
This is Chris with the Golden Ranch Fire. I can't express how awesome that was, what she just said, because being in charge of our peer support team, we face a lot of PTSD in the fire service along with the police, and it's similar to the stressors that everybody has, right? So something that we really like to give our firefighters is just to slow down, because everyone's moving too fast. You can't enjoy the frames of life if you're moving too fast. Slow down, work on breathing. Breathing exercises is the most incredible thing that'll ever happen to you. If you don't know how to breathe, you're not going to know how to relax. There's multiple ways to breathe, and there's multiple resources out there on breathing exercises, YouTube, internet, all over the place. Breathing is incredible. It helps you slow down. It helps you enjoy life and enjoy those frames that you're going to gather. And there's multiple apps. Smartphones are everything. There's apps that we really like to show people on how to meditate. If that's not your thing, great. But if it is, meditation is incredible. and just thinking positive. So those are just a lot of the things that we like to give our firefighters to just help with life. And I think that would help anybody.
Shannon Stickens, Southern Arizona Psychological Association, SAPA. I also want to point out that we have a wonderful recovery and community here in Tucson, Alcoholics Anonymous, Narcotics Anonymous, Sex Addicts Anonymous, and Al-Anon. And so I think it's important to reach out to those recovering communities and get connection through those.
Courtney Schuneman, SAPA. I think it's really important, again, for that prevention to be able to check in with yourself and actually think, how am I doing? Like today, I'll be honest, I was running from one place to another, the hustle and bustle. My kids are in school. It's my one day off. I got to get everything done. And I got in the car and I'm like, this is frustrating. And so I walked the walk instead of just talk the talk. I listened to my little sweet Christmas song and I did some deep breathing. And one thing I really like also is progressive muscle relaxation. I do a very quick form of it where you almost tense your entire body and then shake it out. You can find some great resources on progressive muscle relaxation and other relaxation methods in a quick search, or also I have some information down there. There's some great apps, Headspace, Calm, Omvana. There's some awesome apps for meditations, for mindfulness, on how to just be in the moment to change your perspective on things. Because a lot of times you can't change the situation, but you can change your reaction to the situation. A lot of times, so even though there's amazing apps and a lot of great resources using technology, a lot of times it's also put the electronics down. We're glued to this half the time. How do we just take a break away? And I think you spoke on that, and I love that. And then another thing too, is stop people pleasing. You want to make everybody happy. Got to do this for this person and this for this person and this for this person. And although it is the spirit of giving, it's also about making sure you're taking care of yourself. And I have my clients like put alarms on their phone to check in and say, how is my mood right now? Or I do love like watches that you can use that tell you to take a deep breath and actually practice taking a breath in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds. And then I think one other thing I really like to have my clients focus on is an attitude of gratitude. So how do we focus on maybe times are tough. Maybe money is short. Maybe, so-and-so wants this, or, grandma wants this and aunt wants this and everybody's unhappy. How do we focus on all the things that we do have? We have an amazing community, amazing resources. We've got, so much that so many other people in the world don't have. How do you focus on that small little thing? Even like the turtle going up La Cañada just brought so much joy to my day. Seeing that, it's the small things in life that can just bring so much joy. And how do you focus on the little things and remember to take stock on what's really important in life, because it's the little things that count.
Okay, so do we have any other questions, comments, anything anyone in the audience would like to share? Also, those joining via Zoom, also that's an opportunity. If you'd like to raise your hand, we can unmute you. No? Okay, I'll come to you.
Hi guys, Felix Spacadoro again. I think I heard the sergeant and the fire department there mentioned something, and I wanted to ask for a little bit more clarity on. And you refer to a crisis response team, because if there's someone who's having a psychotic event, one of you guys are going to get called. How is that structured for you guys, so that families know that when they call you, it's not just the police that are coming and just going to take their loved one away. So how does that play out and how do you structure those teams? I'm just curious because where I'm from, we don't have those.
Jason Oretsky, Oro Valley Police. So it's not for the police department to structure, if you will. We will respond to a member of the community in crisis, and with our officers, we're trained in crisis intervention. So we'll recognize that an individual is in crisis. We make the calls for the family. We need additional resources to the residents. That's where crisis mobile team comes in. If the case is where we have to displace that person, where they need additional treatment, we can take them to the crisis response center. But that's also working with the families.
This is Chris with the fire department, and he said it perfect. If we have to displace an individual due to a medical emergency, we'll take them to the hospital of the family's choice. But we are trained in getting people the proper people to assist them. That's where the crisis mobile team comes into play. But yeah, that's really our
This is Maria with Arizona Complete Health, so I'll answer that for you. So yes, so the crisis mobile teams are, we have provider agencies in town. That's all that they do. So think of the crisis line as your mental health 911. So if you needed to call the crisis line for a loved one, for yourself, for a family member, know that a crisis mobile team, which are behavioral health technicians, who are trained in that assessment and intervention for that person in the moment, whatever that crisis might be. Could be substance, could be mental health, could be both. So they're trained to help assess that person, get them stabilized. So know that if you call 911 and you let them know, I have a family member or myself, I'm experiencing this mental health crisis. You explain what your symptoms are. You can always request a crisis mobile team yourself. And I will even go so far as to say, if you don't feel like you need a fire response or a law enforcement response, but you still need a mobile team, you can still call the crisis line. You don't have to go through 911 first to get that response, if that makes sense. Absolutely. Absolutely. Yes. Yes.
That was a really good question.
I would agree. I think that is a lot of times, excuse me, when you're in crisis, you don't know. And then when you call 911, you just don't know, right? So perhaps we organizationally, gosh, hang on. I know you did. Organizationally, that may be something that we should do a better job about. What happens in a crisis or in a mental health crisis? What happens, and kind of walk through generically. You call 911, this is what happens, and you have these professionals come out because it's scary and you don't even know what to call or not, right? So anyway, I have to go.
Just real quick, just real quick, Shelley from NAMI Southern Arizona. Just so you know, firsthand experience with a child with mental illness and family members, Arizona has come a long, long way when it comes to a MIST team from the Sheriff's Department and the CI team from the Tucson Police Department and the CAP from Oro Valley. We've really come a long, long way. Granted, a lot of people are still learning more about mental health, and it's taken COVID for that to come about, believe it or not. The last 2 years is when people are really starting to learn more about mental health and mental illnesses. And and in doing so, I mean, we really have come a long, long way. So people are scared to call 911 when they think their loved one or family member is going through a mental health crisis, but they're not quite sure, because you don't want to send 60 million squad cars out there and get them bombarded. That's going to make it all worse. So that's why I am I come from California. They don't have anything like this. And I'm very, very happy to say that coming in and living in Arizona, we got a long way to go. But we have come so far in just the last 2 years coming out of COVID with our MIST, our CIT, and our CAP programs.
This is not really a question. It's more of an observation. A number of years ago, we had a little gentleman, almost like a gnome, in the basement where I was working at Harvard. And my boss went down and said, what is it you do? And he said, I'm very interested in whether mindfulness will help patients get better. The little gnome's name was John Kabat-Zinn. And he's written a couple books that are absolutely outstanding. One is Wherever You Go, There You Are. And the other one is Full Catastrophe Living. And the Department of Public Health at the university, I think 2 years ago, invited him out, and they filled every amphitheater they had there. It gives you an idea of people no longer stigmatizing mental health, which is what we used to do. My last quick anecdote is that working with John Kabat-Zinn, we had interns we measured everybody's stress on the house staff, and the interns level was incredible. And so what we decided to do was to try to teach them mindfulness. So in the midst of all these things they had to do, John would sit down with them and try to teach them how to get themselves focused. And there were an awful lot of them that said, I'm just too busy to do this. I got too much going on in my life. But later on, they realized that they could control it. So I think what you all are doing up there is a wonderful, wonderful thing for our community. And I want to thank all of you.
All right. Do we have any other comments from the panel or anyone? No? Well, I'd like to thank everyone for coming today. Again, these conversations are really important for our community to have, and this will be posted on our website. The recording of this Zoom, so it will be available to anyone who would like to see it, and all of the great discussion we had tonight. Thank you to our panel for being here, participating, and providing some really great insight into our topic tonight. So yeah, like I said earlier, this is a program that we're still developing, and we're hoping to provide more programs. We've talked a lot about mental health first aid, and some other, breathing, meditation, like Chris mentioned. Those are things that really fall well into our parks and recreation wheelhouse. So some things we're looking to try and expand this program and continue to have these conversations, so we can hear from our panelists and our community in terms of what they would like to see. So thank you everyone again for being here, and that will conclude our event. So thank you.
Thank you.
Thank you.